Hi all, welcome to this short video for Unit 2, Health and Social Care, Working in Care. I wanted to spend a little bit of time just talking about how to do those 6-mark questions and really to explain the explain 6 markers. Particularly, there's a key word that always comes after that explain, and it's either what, how, why, and I want to explain how to work through those questions. So if we look at this question here, so it's talking about Harry. He's 23. He works and goes to a local college. He has a medical condition. He spends time in hospital. He has a learning difficulty. This is not an exam question or an official exam question, but it kind of gives us what we're looking at here. And what I want to flag up is the question says, explain how Harry can be kept safe while in hospital. Now, the key word that you always want to take a look at here is the second word of the question. In this case, how. When you're doing your answer, putting your answer together, make sure any point you make, you then tie it back to this. How, what, why has that got an impact or having an impact, or what's it got to do with the question? So I got the mark scheme, and the mark scheme talks about, risk assessments is ways to keep them safe, following policies, safeguarding. These would all be the points you would make to get your 1 mark. What you then need to do is talk about how these things would keep Harry safe while in hospital. What does this do? So you're kind of developing, building on and expanding on your points. So I got my class to put some together, and again, taking those ideas, I've kind of put them here for you to see. So one of the arguments my class made was making sure there is secure access to the ward. So that's a really good way to keep someone safe. There's a unit, the ward he's on is secure. People have to go and sign in, and that would be a key way of keeping someone safe, a closed setting. The how, so how this keeps Harry safe, is this second part here. So it prevents strangers or those who do not need to be on the ward from gaining access. It ensures everyone who does come onto the ward is monitored by staff, go through the rules, go through the regulations. So that's a really good way of taking a point about keeping a safe, closed setting and then making it relevant. How is that going to keep him safe? Protecting his data is always a key term, key sort of topic area. So keeping his data safe. Now that's a way of keeping him safe, protected, maintaining his data, his privacy. But again, how are you going to do that? So protecting his personal information keeps him safe. And you might talk about locking it away, keeping it safe, secure, keeping his files to hand. Going the same route as the data. One of the things you can do to keep Harry safe is make sure his data is up to date and accurate. So kind of building on from that previous point. Again, avoiding duplication in treatments, not being prescribed medication that others interact with, so making sure his patient records are up to date and accurate. Medical or medicine checks and prescriptions are carried out by the staff. Again, another way to make sure he's safe, that he's not given medication going against his beliefs or medical needs like allergies. Ensuring staff have been trained in safeguarding policies in place. That's one way to keep him safe. The how is to make sure that staff are aware of signs of abuse, neglect, and they can respond if there are concerns, and they know how to report it. You might want to talk about monitoring the staff. So one way to keep Harry safe is to ensure the staff are monitored, and that would be through line manager reviews, CQC checks. And again, this is all done to make sure the staff are trained, they're doing their job properly, and they're keeping patients like Harry safe. A risk assessment, nice easy way to keep someone safe. Again, how is that going to keep him safe? If it's carried out on the ward, they identify risks to patients or to Harry. They can take action to reduce and minimise risks. And last but not least, PPE. We've all been familiar with PPE. We all probably have a load of PPE knocking about at home. And again, one way to keep Harry safe would be ensuring there is PPE and correct equipment. So this will reduce risk of infection spreading. This will reduce risk of injury, having those COSH procedures of handling, storing chemicals. All of that will keep Harry safe while he's on the ward if they are followed. So again, not really much here, but I just wanted to emphasize, when you're looking at a 6 marker, it's always explain. You're always going to identify a couple of points, but do make sure you look at the second word, how, why, what. Try and make sure you are emphasizing that point in your answer. How is that going to keep him safe? Why are they keeping him safe? What's that going to do to his care? So try and make sure you're emphasizing that in your answer to ensure you're picking up as many marks as possible. And there we have it. So as always, thanks for watching. Hope this has been a help, and good luck with any exam papers you're sitting.